I was surprised when I first met Dr. Chase and I heard that the age range of the patients is actually, the youngest is, I think, something like 8.
We've actually seen a few,
Younger than that.
very infrequently, but on occasion, we've had patients that are as young as 4.
Oh, so,
Excuse me.
and the oldest is up to 82, I think you said to me.
Yeah, in her 80s. She was a great young lady. She's a lot of spark in her. Piano instructor. Always wanted her teeth to be straight and finally decided she was going to do something for herself. So there really isn't an age that you can't get your teeth straightened as long as you're healthy, and we would determine that.
Tell me about the 4-year-old. What kind of a case was that?
He had a growth issue in terms of where the skeleton was taking his lower jaw and the upper jaw, and he was having difficulty eating. So we had to expand the upper jaw in order to match the lower jaw for him to properly eat his food.
So that's the way he was born that way.
He was developing that way. I don't really know how he looked when he was born. I wasn't there.
Probably no teeth at all.
No teeth, not in the mouth anyway.
I have a similar story. I had an 87-year-old patient. I treated the granddaughter.
No, I also want, you just moved back to New England from Florida.
That's right.
You were practicing in Florida for 17 years, I think.
That's right. I was practicing. I had a practice with my brother down there, and I did my residency at Boston University and wanted to move back up here. And
it's nice during the summer, but in February you'll regret the move.
Last winter was pretty mild, but yeah. But I love the change of season, so it's okay. But I did have a patient down there. I treated the granddaughter. Grandma saw and loved the results, and she was like, "Is there anything you can do about my teeth? I just wanted them corrected forever and ever." And we wound up putting braces on her. She came in, her makeup was always perfectly applied, her hair was perfectly
87
done.
years old.
87 years old. She drove to her appointments, never missed an appointment, took the braces off. She was my best retainer patient. She constantly wore her retainer, and she's still happy to this day.
And she actually had her original teeth?
Yep, her original teeth.
Okay, so that's an unusual situation, I think,
Yeah.
right?
She was a youthful 87, but she was a great patient. Very, very happy with the results.
Because I've been doing some PR work for ARCH for a couple of years now, but I've always been surprised at the age range because it really, most people still think that it's just children.
Right.
And I know that
Treating a lot of adults now.
it's the whole spectrum.
Sure.
Do you have a story like that, Dr. Cohen, about some older senior citizen patient?
Well, I did see a patient in the Canton office that came in, and I believe she was actually in her 90s, and she was concerned about a little space in the top front teeth.
A little space at
She
90.
came in with her driver, actually.
Was that her worst problem, a little space?
Well, it was bothering her, and she said it was, making her a little self-conscious about smiling. So.
And I suppose that's going to grow in popularity as we have more and more centenarians, right?
Right. People living longer and want teeth.
There was a patient that Dr. Chase had, I believe from Brockton, who was in her 40s, and she had, we won't mention names, but I interviewed her. She had 3 or 4 different reasons why she needed to have really, really good-looking teeth that wouldn't distract remember the story about it?
Sure.
It was interesting because I mean, besides the fact that she just, for her own personal image, wanted to look better, but there were like 3 or 4 different reasons that she needed to look better.
Well, she needed to function better. She needed to eat better. She needed to speak better. She was a teacher, and she had a resounding overbite. It was huge, and she'd gone to about 3 or 4 other orthodontists who were recommending surgery as the only way to adjunct the treatment in order to make the bite come together the way it's supposed to. And I looked at the case, and she was absolutely against surgery, and I came up with a plan that allowed us to, in effect, bring the top teeth back to the bottom teeth without surgical interference or intervention. And she's thrilled. She's a teacher. She felt very self-conscious where her students weren't listening to her, but rather looking at her because her teeth were so distracting. And since her treatment's gone on, she's absolutely thrilled. She's got a world of self-confidence and has.
I remember
has
she was teaching, but she was also a trainer for a restaurant chain, and she had to give presentations, and she was self-conscious talking to the other managers of other stores. She was also in a choir, and she thought that she was very self-conscious about the way her teeth looked in the choir.
Right.
And so the teacher thing, the presentation thing, the restaurant management thing, those and then her own personal life.
Any social arena, the first thing that you see when you meet somebody is a smile or not a smile.
And that's really what you're working on is the smile. I mean, you know, they say sell the lawn, not the seed. You're selling the smile, not necessarily the technical stuff that's going on.
Well, I think that the patients come in wanting an outcome. They don't often have a consideration for what the function means. They only have a consideration for what they look like. We're in an aesthetic society, in a society where we first care about what did Billy Crystal say back on Saturday Night Live? It's better to look good than to feel good, and you look marvelous. You know, this is where we are. We've been this way for a long time, and if you're not happy or thrilled with what you look like, we can make that difference. But there's more than just the look that we do. What we do is very important for function, very important that for eating. If you're not chewing your food properly because the teeth don't come together, you're not benefiting from the nutrients of the food that you're eating to a large degree, because digestion begins with the proteins in the mouth. If you are not biting together completely with all the teeth, there's oftentimes functional issues in the jaw joint. Some people call it TMD, some people call it TMJ. It's a pretty debilitating pain that can happen.
Was it the pain? People don't necessarily know why they have terrible pain in their jaw from TMJ. I get temporomandibular joint.
Yes, temporal
Disorder.
mandibular joint
Yeah.
disorder.
And-
And so
and-
it's not only caused by a malocclusion or a bad bite. It is caused sometimes by that, and we can correct that aspect of what it's caused by.